Hi, I want to welcome you to today's webcast on Patient Family Virtual Connect. So today we're going to have two great presenters. We have Jim Warner and Scott Cranfill that'll be speaking in a moment. But before we get started with today's webcast, we do have a couple of housekeeping items that we want to take a look at. So let's go ahead. First of all, this event, like all events that we webcast here, is brought to you by the Microsoft Healthcare and Life Sciences Group. You can always find us and our colleagues, including the recording of today's session, at our blog at aka.ms/HLSblog. That's aka.ms/HLSblog. So be sure to check it out and all the great content that people are posting there. Before we start, a couple of housekeeping items I just want to call to everybody's attention. Number one, we encourage our attendees to ask questions. So ask. We want to hear from you. This is your time. We have, like I said, some great speakers today. They're going to be serving up some incredible material to help you and your organizations. Please ask questions, get them answered. If we can't answer them today here, we'll certainly have follow-up. Number two, all the questions are moderated. So that means when you post a question, our moderators, like we've got two great folks today handling moderation. So we have Sam Brown, or Samantha. She will be our primary, as well as Pete Anello. So we've got two incredible folks that are going to be moderating. They'll see your questions when they pop up. They can respond directly to you to clarify, as well as publish those so everybody can see them. And then they'll be rolling those up and teeing them up for today's speakers. So that's how that's going to work. The other thing, we love to know who you are and where you're from. We have had folks from all over the globe, including we've had Hong Kong, we've had Japan, we've had India, we've had St. Petersburg, Russia, and we've had Kiev. We've had all over the planet, right? Last week, our first shout out was from Dubai. So let us know who you are, or if you don't have to say who you are if you don't want to share that. But we'd love to hear where you're watching from. It's just fun, and then we can give you, we'll post that, and it's always fun. We don't have a formal contest, but who is joining from the furthest point away? That's always a fun one. So let us know. We'd love to hear from you. Before we start, let's get this question out of the way. I'm sure we'll get it during the session, but yes, there will be a recording of this session made available. For the first time during our last broadcast on Tuesday, Sam Brown took over and actually took that load off my shoulder, so I didn't have to worry about it anymore. She'll be taking the recording, posting that up, as well as any resources from today, which will include a link that'll get added tomorrow or roundabouts, where Jim and Scott are actually creating a standalone post with a lot of in-depth portions around that, and they'll speak more to that. So we'll have a post that'll be more in-depth, but the recording will be this afternoon, and then we'll link back to that piece after the fact. So look for that. Finally, the engagement panel. How to engage us in the engagement panel. If you are not seeing the engagement panel, which you should, if you're not though, you will notice in the upper right-hand corner, there is a little dialog box with a question mark. Click it. It'll open it up. When you click it and open, if it's already open, it'll close it, by the way. You'll get this kind of a view here, and that's the QA panel. You'll notice you can put your name. It's optional. You don't have to. You can ask a question, and if you want to click post as anonymous, that means we'll never know who you were. It's kind of like secret agent. So feel free, post your questions. Like I said, then you'll see it appear under my questions unless we publish it for everybody to see, which we normally don't do. But we may. We'll definitely post your shout out. So let us know. Again, and look at that. Somebody already posted something under new. I'm seeing that in my view. So you're obviously getting the hang of that component. And that's it for me. So I am going to turn over. Starting off will be Jim Warner. And we're going to go ahead and on to the presentation. Jim, if you want to share your desktop or application, it's in your ball court.
All right. Thanks, Mike. Yeah. Hey, everyone. Yeah, I am Jim Warner. I'm a technical specialist here at Microsoft, and I have Scott Cranfill here as well. He's a technical specialist. I handle the collaboration platform in Office 365, and Teams is one of the near and dear to my heart, and I'm hoping that the solution can work for everyone in the provider space that needs a little hand at this time. So Scott, if you want to.
Yeah, sure. Hey everyone, Scott Cranfill. I'm a Power Platform technical specialist. So I've been working with Jim on the solution that he's about to share with you.
Yeah. All right. So let's see. So let's just go right into it. And hold on, guys, got my screen, and there we go. All right. So we're really here to talk about some of the challenges that are going on right now in the healthcare space, right? So from a standpoint of the patients connecting with their families, and even the patients that aren't that don't have COVID, that are in the hospital for other reasons, right? This impacts them as well because of the restrictions on visitors at hospitals right now. And this is really a solution that will be enabling healthcare providers to address a couple different scenarios, including keeping your extended care team safe, right, to reduce the infection risks and whatnot. So the Patient Family Connect is a communication solution that we've been working on here at Microsoft. There's a bunch of people that have been involved with this from day one. So can't name them all right now, but thanks everyone. And I've been talking to a lot of different providers, and I got to say as well that thank you to the ones that have been working with me and collaborating on the solution as well. So the Patient Family Connect is really a communication solution that provides a way for patients to communicate with family and friends. The patient or care team member, if needed, can initiate an ad hoc video call using Microsoft Teams to families or friends that are using Skype Consumer, right? So, sorry, I'm supposed to advance the slide. And what's really nice about this solution is that we're given the opportunity not only for the patient to reach out to their friends and family on the Skype Consumer side, but we're also given an avenue for the friends and family that are using Skype to contact the team or the patient directly using, through Teams. So hopefully this is why you're here, and hopefully you'll get some benefit out of this. But the other component of this is, the safe patient communication or virtual care, virtual rounding. There's all kinds of terms out there for it right now, but I'm going to go with safe patient communication because it's really a way for to leverage the foundation. If you want to use the patient family connection kind of solution that we're having here, or that we're going to talk about, you already have the foundation for patients and care teams to communicate as well virtually, right, from a virtual care perspective. Help with reducing the infection rates and reduce PPE dress out. And really, at the center of the solution is the patient, right? We're providing a way that a lot of providers are struggling with to communicate. So. And this is what it looks like from a high level, right? So on the patient side, they have the ability to do ad hoc communications, right? This would be a way for them to initiate a call, a chat, a video call, audio call with their friends and family. It is a one-to-one communication, right? It's using Teams on the patient side, so this could be on a device that is controlled by the provider and with Teams on it. In this scenario, we're actually setting up a unique patient ID, right? First name, last initial. We collect some other information, as you'll see in a minute. And it's a way for, not only can they have one-to-one communications with their friends and family, but they can also have multiple communications. So if they have a conversation going on with dad or son or daughter, grandparents, they can have these multiple communications happening as well. So on the friends and family side, again, it's an ad hoc communication, right? So it can be initiated at any time. It gives them chat, audio, video, and the Skype account is a personal account. It's a Skype consumer account. So there's no need for a provider to provision anything, to set anything up on the other side. It's something that's managed by the family and friends. One of the nice things about using Skype is it works on any device, right? So I'm hearing a lot of solutions. They're using FaceTime. It's very, meetings. There's all kinds of different solutions out there. This gives a way, when using Skype, you can be using it on a Android, iOS, computer. It doesn't really matter. So what does this look like from a work stream, a care team that's provisioning an account for a patient, right? We have developed a Power app that, well, I should say Scott has. So this app is provisioning an account, potentially mailboxes as well. It depends. We'll get into some of the technical details, but really this sets up an account that's specific to the patient. And what it does is it gives them a quick way, whether it's a care team, it's a unit clerk, a clinician of some sort, patient experience team. It gives them a way to do this very quickly. As you can see in the video, this is me fumbling around in this video recording, but the essence is that even though I fumbled around, it still only took about 19 seconds to create this account. And at the end of this, we have certain information, right? This information is then used by, again, the extended care team, whoever's doing this process. They can put in the email address or log into Teams on the patient device as that patient, right? So when they initiate a conversation with friends and family, they're not coming across as bed one or whatever. They actually have a persona that's personal to them. But from here, we collect a couple different things, right? We got the email address, we've already provisioned that, we got a password, and at the end of that, you log in as the device and they're good to go. That's really all there is to this, right? And I know every work stream will be a little bit different, availability of devices and whatnot, but for the most part, that's a very fast way to get this up and running. So what does it look like from a patient perspective or a care team member that is helping a patient do this? Again, there's some dependencies here, right? Just like you would be collecting a phone number for friends and family, you could be collecting email addresses of the Skype users or handing out the email address that we just saw on the prior screen to the family so they can contact the patient directly. So in here, this is starting up a new chat. This is on the device of the patient, right? I'm putting in an email address for the Skype user. I can knock right through chat. I'll use that term. That we establish some sort of connection first, maybe, and then make a call. Pretty easy. So there's nothing too crazy about this. I think most people understand this workflow. It's a common thing that we do every day. So it shouldn't require a ton of training, but like I said, there are some dependencies of the family having Skype and knowing the address in this scenario. What does the family see? Same thing. People are used to this. They can initiate a call. They can accept a call. They get a ping that someone's chatting with them. So it's pretty straightforward. And in this scenario, thanks Sam for volunteering on this one. But it's just like on the team side. We got chat, we got audio, we got video, and it's pretty easy to do. So what happens when a patient's discharged? Using the same Power App, we can remove the account as well. So again, we're trying to streamline this process, trying to make it few buttons, few clicks as possible, right? I pull up a list of patients and I remove them. So what are some of the benefits of this, right? We streamline the process on the care team side. We give an ability to the patient to contact family and friends, right? So those are two of the main, those are two big ones as far as we got to keep this easy for the care team, and we're giving them an ability to chat with loved ones. From the IT standpoint is, didn't really cover it, but I'm proposing that providers stand up a dedicated tenant to do this. This gives us a couple different advantages, right? There is no commingling of data, right? A big worry when you start having all this stuff going on. If you introduce this into a tenant, there's a lot of work to do. This is really meant to give a pointed solution at a critical time and to be able to do it quickly and also to sustain it through this crisis, right? There's also no crosstalk. So in the scenario that we've outlined so far, when you start using generic things, right, like a room number or a device name or whatever it is, there's always the potential that you'll have crosstalk where someone's going to be trying to contact that device again a week later. So just wanted to take that right out of the equation. That's why these accounts are personalized, so we don't have that problem. This whole solution as well is, it's really pretty easy to implement. So what are some of the components? Again, I mentioned the dedicated tenant, Skype consumer, federation has to be turned on in the tenant. And this is a feature that is coming soon. It's in tap, but some taps are closed right now. But basically, this is coming soon, very soon. So this could be something you leverage in the very, very near term. There's also a promotional offer right now with E1 licenses for this COVID outbreak that would be required. So if you have for example, projections, so a couple of my providers are saying they expect about 3,000 patients at any given time that are being cared for in this situation. So that's something that has to be considered. How many licenses are you going to dedicate to this? There's a Power Automate piece of this. So the provisioning side of the account creation and deletion requires Power Automate, but there's trials out there for that. We're going to provide the Power App and the Automate solutions here when we post out to the HLS blog. And it's really a handful of policies that get created, and Teams policies and Exchange address book policies, depending. And again, the technical documentation will get into some of those things. And really the other component would be the devices, right? The devices that are ending up in the patient's hands or in their rooms. So that's obviously a requirement here too. And on the friends and family side, Skype consumer is required. Microsoft accounts work best with Skype, right? Outlook, Hotmail. Email addresses are required. It can't be a Skype or a Skype account based on a phone number.
So, Jim, a couple of questions. We have a lot of great questions coming in, especially for the family side of this. So I think this would be a great place to pause. Carlos is actually asking, what would you do if the patient is a child? Would you recommend the caregiver get to do this like on behalf of the child? Have you worked through that with any of your customers?
Not so far, not directly. I mean, this is a judgment call. I don't have an easy button answer for that one, right? Mm-hmm. Depending on the age of the child, their capabilities. I can tell you most of the kids I know can probably do a chat and a call. The availability of the device is, I don't know. Every provider is going to have a different scenario. So that's a good question, but it's really going to be a discretional type of thing.
Yeah, I would add in one of the use cases with one of our customers, the nursing staff will provision the account through the app and then log into Teams with the email address that was generated and the password, and then hand that off to the patient for them to use within their room. So the nursing staff, in some cases, will be involved in at least getting that device to the patient, and then can provide them a minimal amount of training on how to use it.
Yeah.
Awesome, thanks. And we have a couple of questions coming in about Skype consumer. So does the family need to have the Skype app, or can they connect through the browser?
Yes. Yeah, so you can do Skype through the browser. You can do it through mobile apps. There's, all kinds of different things. I have it running as the app on my desktop. You can also use it through the browser, and I also have it on my mobile. So I get like rings on a bunch of different places when people call me. Good question.
Awesome, thanks. And then what is the effect if you have like 2,000 beds on Office 365 accounts? Have you run into that with any of your customers yet?
Where they have 2,000 beds and just, sorry, I might have missed something there.
Yeah, I think they're just asking about like, is there a maximum number, or like how can it be divided if there's a lot of different beds in different rooms? Just kind of exploring that.
Yeah, so the way I read that is the question was the effect on my number of Office 365 accounts. And what Jim has shown here is that we recommend a separate tenant for setting all this up for a variety of reasons. But and within that tenant, take advantage of the COVID E1 license offer. And so that would be completely separate from the existing tenant and licensing agreement that you have with Microsoft.
Right. Yeah, this is a quick way to do something without barriers of using your tenant. Can you do this? Can you retrofit it? Absolutely, but you're going to probably be working on plumbing, information barriers, lots of different address policies. So.
And we have a couple of questions around HIPAA compliance. Can you talk through HIPAA compliance with Skype and Teams, and is this solution HIPAA compliant?
Teams is HIPAA compliant and Skype is as well, I believe. I'd have to go look that one up, but Teams is, yep. Right, so I'm not sure what the regulations are right now. I've heard different variations of what exactly this means. This scenario that we're drawing out here is for virtual care. basically, right? I'm sorry, for the family to connect with their with the patient, right? That's the primary purpose of this one. Virtual care is an offshoot of this, right? The foundation will be there and whatnot, but from a HIPAA compliance, really the communications we're talking about is like video calling. It's ad hoc video calling. That's really what this is. Is there some chat information go between patient and family? Absolutely, right? They have that capability. Does that mean that that's what they're going to be, you know, are they going to be sending credit card information? They're going to be putting account information? I don't know. But when you deprovision this account, that stuff goes away, right? So one of the other advantages I neglected to cover is, in this scenario, we're creating the unique ID. So if devices are at a premium for the patients, patient A has the device, they're talking to their family, maybe they get it Monday, but that device has to be moved to another room, to another patient. You can always log out of Teams out of that device as that patient, log in as patient B, give it to patient B, they use it. When that device, when they're done with it, log out of patient B, log in as patient A, give it back to A, and they have all their conversations going on as well. So you can actually use this device and move it around, right? So when your devices are, you know, when you have don't have enough to go around, this could be a potential solution for that as well. I'm hearing that 17 days is the average stay, and this gives them a way to always go back to prior conversations, not have to enter emails again, not have to break down the machine, reload it, re-image it, give it to someone else, and do the exact same stuff when you go to a different patient. This gives you a quick way to log out, log in, and move the device.
Perfect. Thanks, Scott and Jim. We do have another question around if patient accounts can be timed to auto delete or reset with this release.
Want me to address that, Jim?
Yeah, go for
Yeah,
it.
so the process of provisioning the account in the tenant is done through a Power Automate flow. So we have a flow that is making a call to the Graph API to provision the account within Active Directory. And so because we're using flow, then you could schedule an event to delete that account after a period of time automatically, so that every, you know, let's say you want to do it every 30 days or every 15 days, you could schedule that flow to go through and delete any account that was created, you know, 15 days earlier or whatnot. So yeah, you could absolutely automate that.
Great. Okay. We have a lot more questions coming in, but I want to make sure that you are able to get through the main components, Jim. So up to you if you want to keep going through.
Okay.
Or
Is it, are they specific to, I'm kind of looking to, are they specific to the patient family connect solution, or
yeah,
is it just an,
yeah,
okay.
they are.
Yeah,
Yeah.
throw a couple
Okay.
more out. Let's see.
Okay, great. So this person saying they love the registration process, but they're wondering how it would work for an organization that's also using virtual rounding, which I know is something you and Scott have worked a lot on.
Oh, this is like a trick question. So virtual rounding is a, that has been published, is a little bit different, right? So this is, it's just a different solution. This is a dedicated tenant. The virtual rounding solution that you may or may not be using it, or you know, that you might be referring to is in the provider's tenant, right? Additional licenses or whatever is happening there. There's some booking. This is all ad hoc communication. There's no scheduling meetings or anything like that. This is like, I'm not sending an email to someone. The patient is actually calling or chatting with family members that can actually receive it on Skype, right? There's no, that's really all it is. It's like making a phone call or a video call. So, and again, this is a standalone solution as far as a pointed solution, I'll call it, just because it is meant to do one thing, right? It's this communication between the patient and family. And as we're about to jump into extending it to, safe patient communications. That's a good question.
Thanks. And then we have one around devices. Does the patient device need to be dedicated, or can it be just a computer that already has access to a camera?
Again, this is a discretionary thing, right? This is something that if you have the devices and you can get into this tenant, it's really up to you. So if this is something that's sitting in the patient room, I've talked to providers that are handling it in a couple different ways, right? It's something that is in the room, or it's an actual device that is giving to them. There's different scenarios. So it really depends on your exact use case, number of devices that you have available or incoming. If you've ordered a bunch, it's really, it's not really dependent upon the device itself. You have options.
Okay, and then we have Brent asking, are there any downloads or plugins required by the consumer, patient, or family, or does Skype and Teams run using WebRTC embedded in the browsers?
Yeah, so you can do browsers, there's no additional plugins on either side. Most of the providers I'm speaking to, on the patient side at least, they have a device of some sort, and they're using either desktop, Teams desktop, or Teams mobile. But they can use a browser, and there's no plugins.
We have someone asking about EHR integration. Does this integrate with EHR?
So again, this is a standalone solution, right? Can you integrate into it? Sure. There's obviously plumbing that gets, involved. There are a lot of capabilities in Teams, and including EHR and whatnot. And this particular solution, it's not really geared towards that. This is meant to go fast, get going, because I know a lot of providers, they don't have these capabilities right now. So integration with EHR, admission systems, absolutely, down the road. This is meant to stand up fast, go fast, and be sustainable through the crisis. But good question, and I'm talking to providers that are already looking at integrating this into their processes.
Great, thanks, Jim. And so one of the questions is around providing just links and documentation for this afterwards. So just to clarify for everyone, we'll have the recording afterwards, as well as any resources that we have regarding this specific topic. And so you don't have to worry about that. We'll post that out definitely by the end of the day today. Another question, can we set up communication with family who doesn't have a Skype account? Can the link be sent to an email address from the app for someone that doesn't have an account with Skype Consumer?
That's a great question. The easy answer is no, right? This isn't something, again, this is an ad hoc. It's not sending an invite or anything like that to initiate this conversation. This is like picking up the phone, making a call and someone picking up on the other end, or chatting, right? So from that regards, it's just a flat out no. But again, part of the work process that I mentioned in the beginning, right? So as a person is admitted and information is exchanged with the care team and the family, they could be collecting that information, or they could be giving the the email address of the patient so they can use it. Skype is free, and in the free version you get all these capabilities. There's a premium version as well, but for this, someone can sign up for free very easily. They can use their browser, mobile app. There's really no impact to financially.
Awesome. And I know this is a question we've been getting a lot. Do you recommend any devices or cases that stand up to heavy disinfection procedures, since a lot of people will be using this in hospitals and want to ensure infection prevention?
Yeah, yeah, I mean, Surface, of course. I mean, we have a lot of capability in that space. You know, I'm not familiar with competitors, but I know we have this is part of what, it's just what we do.
Okay, awesome. Before we move on, just wanted to address a couple of the virtual rounding questions. So we do
Sure.
have a separate session just for virtual rounding that we can direct you to as well. Just want to make sure that we are focusing right now on Patient Family Connect, and we'll definitely get to the virtual rounding questions after this. So John's asking, for the test tenant, is Intune available to enable or configure MAM policies?
So pretty much everything we're throwing out there for this solution to help during this crisis, everything I'm suggesting is free, right? We're standing up a trial tenant. We're injecting licenses into it. If you want to add that capability into it, absolutely. You know, you probably could manage those devices, you know, in a different way. I know a certain provider is managing things through their MDM solution and the devices connected to their main tenant, but the Teams application is actually connected to this dedicated tenant.
Right. Okay, thanks, Jim. And then, is there any way to avoid a patient to chat with another patient?
Yeah, great question. So in the solution, if all you want to do is what we just talked about, there's an option to not create a mailbox for the patient, right? It's not that they're going to be using the mailbox, but we create a mailbox. We can create a mailbox if this is going to be extended to the care team. And the reason why we would create a mailbox is so we can limit exactly who the patient can see. Right, because if they get a mailbox, they'll see the gal, and everyone else will be in the gal, right? All the patients. So you can control it that way. That's moving into this next scenario that we're about to talk about. But if you're just using this for straight up patient communication or patient family communications, we just create an account. And because it's just an account in Azure Active Directory, there's no mailbox, so the gal is empty. So Teams, when you start typing, when a patient starts typing a name, they will not see any other patients.
Okay. I think we should keep moving forward. I'm going to keep monitoring your questions, so feel free to make sure that you're asking away and we'll get to them, but just want to make sure we get to the end of the solution with Jim and Scott.
Okay, yeah, so if this is something that you're going to be looking at doing, you know, you're going to have to make a decision that, do you want to extend this into the virtual care realm for safe patient communications, right? You have the building blocks already. You got a tenant, you got patients in there. You could easily drop in some generic clinician IDs as well, right? So they can start making ad hoc calls directly to the patients, right? So you get a lot of benefit from this thing that you already have. And it would look something like this. Right? We already got a tenant. Patients are using Teams on whatever device. The extended care team could have a set of devices that they're doing their rounding with. And I'm proposing just generic clinician IDs for a couple different reasons, and you'll see it in a second. But so keep that in mind, rounding devices, generic clinician IDs, and a specific, you know, Dr. 1, physician 1, whoever it is, however you want to identify this generic account's attached to a rounding device. A different generic account is attached to a different rounding device, right? So what does this do? This gives us the ability to talk to the patient, right, as the care team member. They don't need to know your information, but you can give that through chat, through the video call. Say, I am, Dr. So-and-so, and they have that information, right? So, but this is really just a straight up call. And what you can do here is, since you have Teams on both sides now, instead of Skype, you're not stuck in, or you're not limited to a one-on-one communication. You can have a group conversation. So as as one person is doing some safe patient communications or virtual care, they can pull in other people into the conversation as well. Ad hoc, you can just add a member and say, oh, dietitian needs to be involved, or whoever, right? And pull them into the conversation if they're available. So it's kind of hard to visualize, right? Just seeing some words. So I thought I'd draw a little picture. So we got a field hospital as an example. This could be an ICU in a certain campus. It could be wherever you need this to be, right? So in this case, I got Dr. Kim, Raj, Han. They're shift one, right? And they're going to need a rounding device. So we have the rounding devices in the field hospital. They don't really leave that area, right? I have my generic doctors logged into those devices, right? So they come in on shift. Oh, yay, no one mess with it. And they start using those devices for that shift. They got to go home eventually. So second shift comes in. They start using that device, right? So that way you're not having to use devices that are attached to another tenant. They're dedicated just for this rounding, right? They don't really, at least the concept is, they don't leave that unit, and they're recycled between shifts. So some of the advantages of doing that, right? So now I have teams on the care team side, and I can take advantage of calling the patient directly, right? Ad hoc communication. I can knock with the chat, say hi. And what this does is it lets them use the basic functionality of Teams. Nothing custom, no add-ins, no nothing, right? This is a, you can leverage the platform because it stores your recent conversations. It doesn't store the actual video call, but at least if you knock with the chat, it anchors that conversation into the chat feature or chat section of Teams, right? I can also leverage pinned at that point. So pinned conversation, our contacts are, we get 15 of them. So they could be maybe critical care or frequent, patients that require more frequent rounding. And again, this is tied to the generic ID, right? So as the next doctor takes control of that device, they'll have all this information and the patients that were rounded, so they don't have to look them up and start the conversation again. But if they did need to look them up, what we're doing with the Power App is we're collecting some information. So we thought we'd put it to use besides just being in the list. And this is what we're using to build Exchange address book policies that limit who you can see, who you can't see. And in the scenario that we drew out in the technical documentation would be where you would leverage those Exchange address book policies. But the extended care team can say, hey, I've got to look up Jill. I start typing her name, and guess what? She comes up and we're displaying the actual information we're collecting as well, right in the title field. So it's easy to understand who this person is, where they're located, to make sure I have the right person. Right, and this isn't, as I mentioned kind of earlier, this isn't just limited to physicians. We could be pulling other people from the care team into the conversations as well as needed. So what's required on this side of things, right? We got an overall solution, patients in the middle, we got patient family connect, we got safe patient communications. We're building on top of the patient family connect to do this. So we already have a couple things in place. We already have patient IDs, right? We already have devices of some sort. Generic care accounts could be dropped into the tenant, right? They're not going to be done through that Power App, but you can create them. And we can, the technical documentation will go into this in a little bit more detail, but it can be leveraged quite easily, that foundation, right? We have rounding devices with Teams installed on them. We have custom Teams policies just for the care team that can say, oh, well, I know this device is anchored to the field hospital. I don't need to see 2,000 patients. I only need to see the patients that are in the field hospital. So we can control that, what that looks like with the exchange address policies. And you also have the ability to customize the Teams policies. By default, a doctor in this fashion, or a care team member, will only see the chat function within Teams, just like the patient would, right? We're removing all that stuff by default. But if you want, the care team, those devices, those IDs on those devices could have all the Teams functionalities. Maybe there's meetings, maybe there's not. It's really up to you. But if you're just using this from a video calling standpoint, ad hoc communication, maybe you just let them have chat and that's it. And they can just call people directly. That's a preference, discretionary, something you're going to have to determine yourself. So now we got all this stuff as well, and we can leverage ad hoc communications, providing, tackling two of the big challenges right now in the provider space, right? From a patient to family, patient to caregiver. But we also have the ability to, and someone from Microsoft, make sure I'm talking about this right. This is, this is in GA right now in preview, is live captions, right? So it's in English right now, but it gives the ability, if someone is hard of hearing, they can actually read on their screen what's happening, right? This is a little bit more about meetings and whatnot, but this is a capability that is in Teams. So I just want to make everyone aware that this is functionality that is out there in Teams right now. So could add to this overall solution. Another tool in your tool belt. Yeah, and as far as the deck, I mean, we're done. So what kind of questions you got for me, Sam?
Okay, we have a ton of questions piling in, so thanks so much for the engagement, everyone. But yeah, that's okay, Jim. Not that many. Jose is asking, should they use the healthcare package Teams policy to limit the clinician's options for HIPAA compliance?
Again, this is a great question. It really depends on the extent of this. If we're not talking EHR integration, we're talking about video calling. So I don't know what that looks like to you from a HIPAA compliance standpoint. Can you leverage those templates? Absolutely. Will it be of any benefit for video calling and whatnot? I don't know. You're going to have to make that call. But thanks for the question.
And John's asking, we've had a couple questions around cost. So John's saying he can definitely see the value here in terms of long-term for patients and their support teams for health and mental health and loneliness. With that said, on the cost side, are E1 licenses going to be required for long-term implementation? And do you know if Microsoft has begun to discuss a specialized license for this solution because of its unique nature?
Wow, that's not a softball. Okay, so thanks, John. So let's see. That's That's a good question. I'm not sure of what licensing seems to change all the time, so I can't really make a comment on what that would look like. We can definitely have discussions on, I know that certain people will see value in this, right? And how they can actually, this could be a game changer in how they do things moving forward after this crisis. So there's lots of potential. What this looks like long-term from an actual patient standpoint, I would think that you'd be looking at a lower license, right? Because you're really just offering only certain services. You know, I don't think you're going to need all kinds of different things, but overall, as you incorporate this into your tenant, I would say that you're going to need certain things. You're going to want to put certain restrictions and barriers in place between patients and the rest of the organization.
Great, and this is more of a softball, Jim. So we have a lot of questions coming in, and I've been answering people privately just because we have a lot of the same themes.
Great.
So if you don't see your question, that's just because I'm answering privately. So one of the things that keeps coming up is just about resources, whether it comes to implementation, just documentation as a whole. I know that we're going to post afterwards with what we have today, and everyone has seen the deck today, but can you just talk about a little bit of what we have to get everybody started?
Yeah, so I'll start, and I want Scott to jump in here in a second. So from implementation standpoint, I would say this is low friction, right? This is like a low drag solution. You can get up and going pretty fast. Requesting a demo tenant, super easy. Getting some licenses, the E1 COVID licenses put into this tenant, you do have to get a code. It's a promotional code that opens up. You're going to have to work with your account representative on that, but basically it's taking those licenses and putting them in there. Those licenses are good for 6 months. So that's a fairly easy thing to do. Most account reps can handle that pretty easily. The other trials we're recommending, right? The Power Automate and whatnot, there are trials available for that as well, and those are anywhere from 1 to 3 months. How long this lasts, and if the solution's right for you, I'm sure that you can work with your account representative on what that looks like moving forward. But let's see, Teams policies, really easy. For the most part, we're changing the default policies in Teams to be restrictive, right? To say, we're not going to show anything but chat for the patients. And maybe I have another set of policies that are applied to the caregivers, right? That will be less restrictive. So those are all really easy to do. We're automating the creation of the patient account, and it's getting dumped into a Azure Active Directory security group, and the E1 licenses are applied there. And like I said, you have some decisions to make. Are you just going to do the patient family and that's all you want? Then you would just turn on Teams, right? As you give the E1, you can uncheck everything except for Teams. If you want to go forward and use Exchange address book policies to do scope searches of individuals, then you'll also have to turn on Exchange Online. So there's 2 checkboxes under the E1 license, but that's all done through the security group, right? It's all handled there. So now that you got all the patients in that group and that configured, you got the Teams policies in place, Exchange address book policies. All these are really pretty easy. There's like tech articles on this stuff. That's not like a lot of documentation. Now, Scott, you can talk about what it actually takes to use the Power App and these Power Automates.
Yeah, so as Jim demonstrated, there's a Power App, which is the user experience component, and then there's the automation behind it that creates the account and deletes the account in Azure Active Directory. So we packaged that solution up, and we'll provide that as a download that you can then import into your Microsoft 365 tenant that you set up for this. And there's a little bit of configuration that you have to do to configure the app to point to the SharePoint site that's used to store this information, but it's pretty straightforward. And we'll have, as Jim mentioned, we'll have the documentation to walk you through that process to set it up. There's also one more component, which is creating an app ID in Azure Active Directory so that the automation has the appropriate permissions to create the Active Directory accounts. And again, that'll be in the documentation as well.
Yeah, so let me make a quick comment on that, because, you know, these solutions that are going to be packaged up that Scott's referring to, they're pretty straightforward. We export them, you import them. There are some, you know, you got to get a GUID here and there and go into a flow and say, I got my flow now, it's imported, but I now need to attach, you know, put a GUID in there, right? So nothing extraordinary. There's no PowerShell. Everything that Scott has done is actually using flow, and it's hitting the graph, right? So this is going to be, you know, a backend process that's all incorporated into Power App flows, Power Automates, and MS Graph. So that's probably the most complex part of it. Is probably, what would you say, Scott? Registering the app.
Yeah, and that's not even all that difficult. I mean, the biggest challenge, well, it's not really a challenge. You have a separate tenant, so whoever is the admin of that tenant will have access to, import the application. Will have access to Azure Active Directory to create the app ID. So, I mean, it's really, I think Jim and I worked on this yesterday to set up a brand new tenant for demonstration purposes. I think it took us a couple hours to do it. Of course, we've been through it once or twice, but
yeah, but that's why we're going to provide the documentation. Yeah. And then from a GUID standpoint, how many do you need? You need the security group GUID. What else? Was there a SharePoint GUID or something? No, you need a URL for that.
You need the security group that you configure in Azure Active Directory to apply the licenses to the user accounts that are being created. And so in Flow, you're going to plug that GUID in so that the user gets applied to the correct security group. And then you need the app ID and secret from Azure to plug into the Graph API HTTP post component in Flow, so that Flow has the permissions to create that account. That's about it.
Yeah, and on that note, so there is the trials we're suggesting, right? There is a requirement there, right? We do need, because we do and correct me if I'm wrong, the HTTP post, you do need those premium licenses for
Power Automate.
Yeah, thank you. Okay. So
we're getting a lot of questions around, is there any ETA on like the guide and availability for the implementation steps? So just to be clear with everyone, we're going to post out on aka.ms/HLS blog by tonight, just as soon as this recording renders, and any resources that we have, we will post, and we will continue to update that as we have even more to give out. So I don't know if you all have anything to add there, Jim and Scott, but definitely want to get them prepped as soon as possible.
Yeah, so I got a couple comments on this one. So the Skype consumer interop is coming very soon, right? So that is the key piece of this. I'm allowed to say very soon. I can't give any dates, but the documentation will be the full documentation. I'm hoping to have everything out there tomorrow. But like Sam said, check out the blog. We will be, updating information there as soon as we can.
Great, I think that's it, Mike.
All right. Well, I want to thank both Jim and Scott today, and of course our great moderators. Sam, you were awesome. Pete, Thanks for some of the commentary behind the scenes that was keeping us on track, and great session. Look forward to hearing more about this. Again, like Samantha said, if you go to our blog at aka.ms/HLS blog, that's aka.ms/HLS blog, it'll bring you here. We'll have the recording up later in the day from today's session, and then there will be a standalone blog post coming for this. Also, just as an FYI, if you one of the most requested things I've personally been getting from customers, I've done at least 1 or 2 a day, is around Microsoft 365 live events, either Teams or via Yammer or Stream. I've been getting lots of questions. And so on Tuesday, we'll be having a live webcast at 12 noon. Pass that along to your colleagues and feel free to join us. But really, if you have a need for large scale, engaging, communications, and you want to use webcasts, this is using Teams live event webcast. I'm going to do a brief presentation, and then I'm going to have wide open QA where we can deep dive into your questions around everything from network topology, CDN, ECDN, various configs. I got a bunch of questions today for if there was a hearing impaired translator and how to keep them in screen and all kinds of stuff. So please be sure to join and pass that along. And again, I want to thank everybody. Have a great rest of the day. And as always, from HLS Blog, we bid you have a great day. Take care. And as always, ciao.